My name's Jeremy Cronemiller. I'm an associate behavioral health counselor, and this is my blue chair story. I was hired in 2015 at Upper Mississippi Mental Health, and Sanford acquired Upper Mississippi Mental Health in 2017. My first position was mental health transport, but I had that position until just this last year. Transported patients in mental health crisis. It can be anything from anxiety, depression, to maybe suicidal ideation or suicide attempt, homicidal ideation, severe psychosis, psychosis being hallucinations. So I transported patients from various ERs in Hubbard County, Beltrami County, Clearwater County, and Lake of the Woods County. So 4 different ERs in the surrounding area to inpatient hospitals where they could receive a higher level of care. For their safety, they had to be stripped of their belongings, they were put in scrubs. Half the patients, the ones that are going involuntary, stripped of their rights. So one of the important things is to kind of give the patients back some of that power, give them back some choice, make sure they feel cared about and feel like humans. It can be very painful for the patients. If I can help make what could be a traumatizing experience for patients a pleasant experience that's healing, I'm giving the patients and their families an opportunity that I didn't get. My older brother and I were pretty close. I remember he built a tree house with me. He bought me my first bicycle. He taught me how to build computers. But he also struggled with a lot of mental health, struggled with chemical dependency. I remember one time I was coming home from youth group and walked into my bedroom. We were sharing a bedroom at the time. He was laying on the floor with an empty bottle of pills. Yeah, we got him the help he needed. We called an ambulance. He ended up going to an inpatient unit. But the whole experience for him was pretty traumatizing. It affected our whole family. When I was 15, right before I turned 16, a good friend of mine completed suicide. She hung herself in her backyard. Those 2 experiences really have shaped my passion for this field. Listening to them is huge. Listening to their fears and then validating them and then kind of giving them reassurance on the next steps. Have them pick the radio station, make sure that they see if they wanted a warm blanket for the ride. One of the big things too is full disclosure, letting them know what's going to happen next, what's the next process, where they're going, kind of what things are going to look like next. Make sure that they know their belongings are in the back of the vehicle. So checking with them for that. Just whatever I can do to make them feel cared about and important. And sometimes they want to talk and I just listen. Or I'll engage in conversation about their hobbies or things they like to do, things they can do for self-care. Sometimes they just want to sit in silence, and it's amazing how supportive a person can be just sitting in silence with someone. I can see a patient that is tearful, they are scared, and by the time the transport is done, they have a bounce in their step, they have a smile on their face, they're excited for change, they're excited for the next process of their treatment. I think one of the most challenging parts is you don't necessarily realize it's happening, but the vicarious trauma that we experience in healthcare, it's a slow thing. It builds up over time. Every time we help a patient, we're giving up a part of ourselves. I would say probably one of the scariest ones was a patient I was transporting that tried to hang themselves in the vehicle with the seatbelt. As soon as I seen him grabbing the seatbelt and pulling it down, I knew what they were going to attempt to do. So I immediately pulled over, called law enforcement, got an ambulance. We ended up having to cut the seatbelt, and we got the patient medically cleared. We got him to the facility they needed to go, but it was a bit terrifying. I used to work 80 plus hours a week. I don't think I ever burnt out, but I could definitely tell that something wasn't right. One of the big things in mental health is that when you're working in mental health, learning to take care of myself so I could take care of the patients better. Just make sure that I'm engaging in things that I care about, enjoy doing, identifying what my needs are and meeting them, and drawing healthy boundaries for myself. I've only been in this new position for a couple months now. So when people call like the 988 line, I work on the amazing team that responds to those calls. So we go in and we help provide support to the patient, and we do an assessment to kind of determine the risk level, determine what the crisis is, and figure out what we need to do next for the patient. I'm excited. It's giving me an opportunity to grow professionally. It's giving me an opportunity to help even more patients. We're changing how patients get mental health care in not just our community, but throughout the entire Sanford network. And other agencies are taking notice of what we're doing and how we're changing mental health care. And I feel like it's making a difference. I feel like we're modeling for our patients what it's like to have good self-care, to be able to take care of yourself, what it's like to have good relationships, which is so huge. There's always this sort of sense of community, and just it really feels like a family.